Hello everyone, and welcome to today's webinar on 8 ways to measure financial health. Just a note on logistics before we get started. Everyone is on mute, and please use the chat box to ask any questions throughout the webinar. So thanks again for joining us. Today, CFSI is releasing the first of several deliverables on our 8 indicators of financial health. Now, before we get into that, I want to give a quick intro to CFSI. We lead a network of financial services innovators committed to building financial health through better products and practices. And we do that in 4 main ways. First, by connecting people, by informing people through our research, through seeding and testing new innovations, and also advising through our consulting services. So please do subscribe to our email alerts. Consider joining our network if you aren't already a member, and also consider working with our consultants to leverage our consumer insights and how that can influence your business. So here's the agenda for today's webinar. I'm going to present the reasons why CFSI thinks there's value in measuring financial health, and then present our framework of components and indicators. I'm going to ask our speakers to chime in throughout the entire webinar to provide their thoughts, and we'll also dive into some specific challenges and opportunities that come with this kind of measurement initiative. We'll then take your questions, so please do submit them as they come to you in the chat box. And then when we finish up, I'll preview some of the other resources that are coming out soon. So let me introduce our speakers. I'm Sarah Parker, and I'll be your host today. We have a great lineup of panelists today. We have Brett King, who's the founder of the mobile-based banking service MoveIn. He's also an author, speaker, and host of the Breaking Banks radio show, and has a lot of hands-on experience that relates to the topics we're going to be discussing today. Michael Collins is faculty director at the Center for Financial Security at the University of Wisconsin-Madison, and he studies consumer decision-making in the financial marketplace. He's also done a lot of work on similar measurement projects, as we'll hear about during the webinar. And Rick Love is a program director at MetLife Foundation, where his work focuses on expanding financial inclusion for lower-income individuals and families. He concentrates primarily on the U.S. in the areas of knowledge and insights. And I'll just note that all 3 of our speakers provided valuable comments on the various drafts of these indicators, so we just want to thank them for their input throughout this research process and also their participation today. So this project, which is specifically the release of our financial health indicators, is part of a broader partnership between CFSI and MetLife Foundation. And I want to give Rick a moment to talk about this partnership. Rick?
Thanks, Sarah. I'm pleased to participate today representing MetLife Foundation. In 2013, the foundation refocused strategically to concentrate the majority of its support, as you mentioned, to help increase financial inclusion of lower-income adults and families globally. Our support is concentrated in 3 areas: knowledge, services, and insights. The knowledge area is about the demand side, increasing the readiness, willingness, and capability of lower-income families to engage with the financial sector. The services area is about supply side, advancing the development of high-quality financial products and services like savings and credit and insurance. The insights area bridges all that we do and is about investing in research and particularly sharing what is learned to inform action. MetLife recognized CFSI very early as a distinctive resource for addressing all 3 of these priority areas. That was because of its capacity for research, technical assistance, innovation, facilitating peer-to-peer learning, field building, and valuable thought leadership. After we collaboratively supported the Consumer Financial Health Survey in 2014, MetLife recognized with CFSI that the information offered insights that should be shared more strategically. The financial metrics work we are here to learn more about today is about an important step forward in a commitment to move real insights to action. I want to thank CFSI and to all of you to say thanks for participating.
Great, thanks, Rick. And in addition to Rick, I also want to call out two other colleagues at MetLife Foundation, Evelyn Stark and Nandika Magdavkar, who have really been very helpful throughout this process of this research and other projects that we have that we're working on together. All right, so let's get into it. Why are we talking about measuring financial health? What's the value there? So we know from CFSI's consumer study in 2015 that most Americans are struggling. Our data showed about 57% of the country that lacks financial health, and that's about 138 million people. What exactly do we mean by financial health? Well, we believe financial health comes about when your daily systems help you build resilience and pursue opportunities. But admittedly, that is a high-level definition. How do we really know if our financial systems are building towards resilience and opportunities? How do providers know if their products are making a difference? So we have begun to quantify and specifically measure financial health. And that's what we have to do, to quantify and measure financial health. But then, of course, the question becomes, well, how do you do that? So over the course of the last year, that's what CFSI has attempted to do, to distill down the various components and indicators of financial health into the fundamentals that can be a good starting point for measurement. So we've identified these 4 components of financial health: spend, save, borrow, and plan. And these 4 components mirror our daily financial activities. So how does this relate to the definition of financial health I presented a few slides before? Well, what you do today in terms of spending, saving, borrowing, and planning greatly impacts your resilience and your ability to pursue opportunities. So these are the 4 components of financial health that would build towards resilience and opportunity. And next to each component, we identify 2 key indicators. So you are financially healthy when you spend less than income, pay bills on time and in full, have sufficient liquid savings, have sufficient long-term savings or assets, have a sustainable debt load, have a prime credit score, have appropriate insurance, and plan ahead for expenses. This is really kind of the crux of what we're presenting today, these 8 indicators of financial health. And then getting to one more layer of granularity, here we show that for each indicator, we then identify the specific data that can be used to measure that indicator. So some of these are pretty straightforward. For the spend category, for instance, how do you know if you spend less than income? Well, you actually have to measure the difference between income and expenses. How do you know if you pay your bills on time and in full? You have to break it down into the percentage of bills that are paid on time and in full. Others here have a little bit more nuance. So what's the best way to measure if you have sufficient liquid savings? Or really what that's getting at, that 3rd indicator is really getting at kind of emergency savings. And here we suggest looking at the number of months of living expenses that someone has in liquid account balances. In terms of long-term savings, you can look at the total amount of one's long-term savings, assets, and investments. For borrowing, in terms of having a sustainable debt load, we suggest looking at the debt-to-income ratio to really try and understand one's debt load. Having a prime credit score, obviously you'd look at credit score, credit quality. And then for planning, we want to look at the type and extent of insurance coverage that someone has. And then in terms of planning ahead for expenses, what are the behaviors that demonstrate future financial orientation? Those are the things that we want to try and measure? What are those behaviors that would demonstrate that kind of future financial orientation? So before I go to our speakers to get their reactions to this framework, let me just say something quickly about kind of how we got here. So over the last year, our team has analyzed data and insights from industry research and benchmarks. And these indicators were informed by data sets from more than 20 consumer finance studies and also consultations with more than 80 financial services providers. And these consultations were very helpful in helping us inform the scope and direction of the indicators and also providing a lot of feedback on multiple drafts. And then we also did a deeper analysis of our own consumer financial health study data to refine the indicators from a much longer list to determine which were proxies for others and then which indicators to prioritize. And that's how we settled on what we have today. So let me just go back to this slide that shows these 8 indicators. And let me turn to our speakers. So I'm interested in each of our panelists kind of talking about the value of a holistic measurement of financial health like this that kind of looks at all of these areas of credit and savings and spending and planning. How is this more holistic approach better than just maybe a credit score, and how can providers and consumers really benefit from this? So I'm going to start with Michael. And Michael, if you could speak to this from your academic and regulatory perspective.
Yeah, great, thanks, and thank you for having me as part of this call today. It's really an impressive effort, and I hope folks understand all the work that's gone into getting to this point. You know, if you think about other fields, like even the health field, you know, we have a wide range of measures that have been used and that we all get, you know, take part in all the time. Every time we go to a physician's office, we do weight and blood pressure and all kinds of measures, and those have really been developed over, you know, generations, over some of them for more than 100 years, and you know, they're all helpful in their own way. And I think what we're beginning to see in the household finance field is this sense of that really we need to think about people's finances and their financial behaviors over the life course in that sort of holistic view of balancing their saving at some points in their life and balancing their credit at other points in their life, and how people think about thinking ahead, how they think about prioritizing what spending and saving and credit choices they make. And that's going to result in different people being at different places. And you know, you and I may be a similar age and have a similar other background, but we're making different choices based on other things that are going on in our lives. So I think this is it's a good development for the field, much like the health field, where we're beginning to realize that we need multiple measures and we need to understand where people are at, given where their life stage is and given the other things that are going on in their life. I also think this broader view is helpful because it starts to get us moving towards measures that are more like a, you know, a well-being or another aspect of just general overall life, rather than just focusing in on, you know, one account or one particular behavior. And I think that's what we mean when we talk about financial health, is really trying to help our clients, our customers, to advance whatever it is important to them, and that becomes a bigger goal than just the dollar amount in one level or another.
Yeah, and you're definitely touching on something that we'll come back to, which is just that will then really depend on people's specific goals, their financial goals, their goals overall in life, and so many circumstances of their life that kind of influence what financial health would look like for them.
That's right, and it's individual, and I think that's what's great about this kind of a measure, is that it allows each people or each person to kind of gravitate towards you know, the factors that are most important for them at that point in time.
Mm-hmm. Yeah. Rick, why don't you speak about this from the funder perspective and also, you know, the perspective of a major insurance company?
Sure, thanks. I will say that customer centricity is a core value at MetLife. As an insurance provider, and MetLife Foundation brings that value and perspective into our support for organizations working to increase financial inclusion. Increasingly, we are discussing financial health or well-being as a desired outcome of financial inclusion. I think in that sense, the holistic metric is a frame that helps discussions of pieces find a relationship to each other. We have valued CFSI's leadership in defining and developing ways to measure financial health. MetLife does its own consumer research, obviously, and some of that I think relates well to the concept of financial health. I'll just mention an annual employee benefits trends study. I do want to emphasize that a little later. At the foundation, our own work on measurement and value and evaluation of our grant making at a portfolio level includes a wide range of direct product and service providers and intermediaries with local networks that are distinctive and often disparate. Common metrics is a challenge, and the CFSI perspective is useful in addressing similarities and differences, and particularly relating parts to a whole. And again, that notion of a frame against which individual work can be compared and can have a sense of adding up to something larger. As a funder, we've been particularly interested in supporting and evaluating efforts to bundle and integrate services to improve financial stability of low-income families. A significant example is the collaboratively funded Working Family Success Network. And it adapts a model that bundles three types of services. One is education and job skills development. A second is social benefits and work supports. And a third is financial education, coaching, counseling, and actual access and use of financial products, particularly credit and asset building. There is a need in that area also for a concept of the whole and for metrics that measure change, behavior change over time in terms of how individuals can progress and how organizations can demonstrate impact. LISC is a leader in this bundled services adaptation through its Family Opportunities Center. United Way has a model that's adapted in the innovative Spark Point centers in the Bay Area. And then finally, I want to mention Achieving the Dream, which is also adapting this model in the community college setting as part of something called the Working Student Success Network. CFSI has been very helpful in that initiative to think about how the larger concept of consumer financial health translates into a definition and potential measurement of student financial health. And we think that is part of the formula for increasing students' persistence, completion, and for addressing potentially some of the student debt problems that young adults carry into their lives that affect financial health for decades.
Great. So you've definitely given us a lot of examples of ways that this concept is already starting to get some traction. Brett, let me turn to you and hear some of your impressions from a fintech startup perspective and just a broader provider perspective.
Sure. Well, it was really ironic that you guys came up with spend, save, borrow, because when we looked at this a few years ago in designing Movin', we came up with three core elements to financial health, which was spend, save, and live smarter. And what we came to the realization is that, like if you talk about physical health and physical fitness, 80% of the population really isn't disciplined enough to apply techniques like getting a personal trainer, going to the gym regularly, and same with budgeting for financial health. So what we realized was we had to sort of change the way we viewed our spend and to gamify that to to really move the needle. The problem wasn't getting people to plan, because that's really, really difficult to do. And if you throw out things like, hey, here's a new savings account, or here's a new investment product, or save for your retirement, that's only going to be effective to a very small part of the population. So we worked on gamifying the financial health thing, and the spending. Really what we found is just by giving people real-time receipts through Moven, where they could get a receipt and see not just here's the receipt and how much you spent at Starbucks or how much you spent on groceries, but how much you've spent so far this month, and whether or not that's more than you typically spend on that type of activity, say eating out, that had a behavioral impact, because a lot of the spending decisions we make day to day, which ultimately affect our financial health because they affect our ability to save at the end of the month, are unconscious spending decisions. So by making those spending decisions real-time and conscious decisions that you're aware of, it had a tremendous effect. So what we found with Moven users is that in the first 2 to 3 months of activity of using the app for our active customers, that they reduced their spending in their top 2 spending categories just as a result of using the app. And as a result, they're saving 10 to 15% more than they did prior to using the tool. So that's just awareness of your financial health, and that can have a huge impact on your day-to-day spending patterns and behavior.
Great. And what's the third component you said was, what was it again?
So we said spend, save, and live smarter. So the whole objective here is that, if you spend smarter, then you'll be able to save, and you'll be able to save for those things that are important to you in the future. And you won't necessarily have to sacrifice. It's not about sacrifice. It's about just being smarter about the way you allocate the available money. The other thing that's very interesting here is that we are starting to see the emergence of the gigging economy in the US particularly. And before, what we would have said is, look, you've got a single source of income. At the start of the month you get paid, or every 2 weeks, and then you burn through that cash, and anything you've got left over you save. But for many people now, they're taking jobs with Uber or renting out their apartment on Airbnb, and they're now looking at supplemental forms of income. And that's really not been possible in the same way it is today. So I think we might see scenarios in the future, for example, where if you're looking at your financial health and you suddenly get an unexpected medical bill, or school fees that you weren't expecting, then you say, all right, well, maybe I'll go and jump in my car and drive for Uber for 6 hours and get some supplemental income. So we're getting to see that there are more levers in respect to being financially healthy. But it's all about the data. It's all about awareness and knowing where you sit in that cycle. I don't believe it's about planning. I believe it's about getting the right data in real time and using that to modify your behavior. So it might surprise some of you to hear, but I'm not a believer in budgeting at all. I just don't think it works for most of the population.
Yeah, we definitely heard that a lot in the research we did and the consultations about how effective or not are our budgets. So there were a few questions that came in when you were speaking, Brett, about the name of the app that you mentioned, and it's Moven, M-O-V-E-N, and you can definitely check that out online.
You can download it from the Apple Store, iTunes. From Android. You can go to the website and sign up. We do offer a debit card with this, but you can also aggregate in all of your other bank accounts, so you can get a complete picture of your financial health in real time.
Yep, great. So let's look at a few of these indicators in more detail. So there are 8 in total, but we're not going to look at 8. I actually asked each speaker to choose their favorite. No, not really, but to choose the one that they specifically wanted to speak to. So we're going to start with this first one under spend less than income, looking at the difference between income and expenses. Let me just quickly speak to this and the next slide, and then Brett is going to talk to us about this indicator in particular. So this is obviously very important because being able to manage cash flow and spend less than income affects your ability to save and be resilient. We're going to talk more about benchmarks a little bit later, but here we intended to stay pretty high level, and we put benchmarks in 3 categories of green, yellow, and red, as you can see there. And then we also recognize that not all financial institutions will have the data to see the exact difference between income and expenses. So we provide some ideas for other proxies that might get at some of those same general concepts. So here, observing increasing or decreasing balances in transaction accounts, or also looking at the velocity of inbound and outbound dollars, may also be able to kind of give some insights into this concept of whether someone is spending less than income. And then, of course, with each of these, there are measurement challenges to consider. So here, consumers might have multiple core accounts. So a provider would certainly want to have some type of insight into those various accounts to see all the income and all the expenses. And yet even then, it may be difficult to discern if a transaction is income and expense as opposed to simply transfers. So there's just often a lot of noisy transactions that are coming in and out of accounts, so it can be difficult to know exactly how to categorize. So those are some of the challenges specific to this indicator. But Brett, talk to us about this indicator and why it in particular caught your attention.
So, the element of the green, yellow, red is actually pretty critical, the traffic light system. It's easy to understand. Red is bad, green is good. And this is a very powerful analogy in respect to whether you're trying to gamify your physical fitness and the number of steps you do each day, or the number of calories you take in, or the amount of cash you spend. So when we were testing various mechanisms, pie charts and bar charts and so forth, we actually found that the more detail you put into the indicators around this, the more complex it is, the harder it is for people to use it to manage as a tool. So we went with something very, very simple with our app, which was if you are spending less than you typically spend, and therefore at the end of the month you're going to save money, the entire mood of the app turns green. But if you're spending faster than you normally do, and that's putting in danger your ability to save at the end of the month, or you might even run out of money before the end of the month, then the app turns red. And you can see this in a couple of different ways. You can see it on the home screen with what we call our spending meter, which shows you how quickly you're spending comparative to your typical spend or your average spend, and also in our money path, which shows you your average spend on a calendar basis and shows where you are this month compared with your typical spending. But we use that green red, and it's a very powerful thing. And what we found in terms of app behavior, which indicates that this simple tool is very effective, is that we find now people opening the app at the start of the day, simply glancing at the app to see whether they're in the green or they're in the red, and that will then determine how they go about their activities during the day, how much they spend, if they go out with friends for dinner or eat at home, those sorts of things. It's just glancing at that green-red indicator is all they need to know whether today they're in good financial health.
We had a couple questions come in after you provocatively said that budgets don't work. Can you elaborate a little bit on what you mean there? And also, just to follow up, what would be put in place of a budget to help people plan?
So I think this is where we, when we looked at this problem, we said, if you look at the 57% of Americans who say they don't feel like they've got control or financially healthy, and it's probably more than that if we're honest. When we looked at, they have the tools available to them right now, but they're not using them. So we asked why. And most people said, look, I tried to budget and I failed. I couldn't stick at it. I tried it for a few weeks, and then just life just caught up with me. So when we tried to figure out a way to digitize this process, we had really two choices. Do we make a digital budgeting tool or we do something else? And instead, we approach this from a behavioral perspective. How do you act with your money on a day-to-day basis? How do you use your money on a day-to-day basis? Is that good? Is that bad? And could we change that behavior by coaching you just every little day, making small changes, rather than trying to get you to change your discipline in approach to this. And that's where I think the problem lies, as we found that about 80% of the US population has a tendency not to be disciplined enough to be able to leverage off a budgeting tool. We just don't stick with it long enough. It's not, human nature isn't that methodical. If you're an accountant, maybe, right? But most of us just can't stick at those sorts of plans. So by creating something that's more like a Fitbit for your wallet, encourages you just every day in terms of spend a little bit less today, or hey, you can spend a bit more today, it's okay. That was enough to really radically change people's behavior in a pretty quick period of time. I mean, talking 2 to 3 months. So
Great.
We don't believe that the budgeting tool is the way to go. We think it's more about awareness and control on a daily basis in terms of your categories of spending, and learning which of those categories of spending are a problem for you on a day-to-day basis so that you can change your behavior there. So instead of going to Starbucks every day, you might go every second day. Instead of catching a taxi to work, you might ride a bike to work a couple of days a week. And those types of behavioral changes that are possible when you understand the impact of, that negative spending behavior is having on your financial health.
Mm-hmm. Got it. Great. So let's move to one of the indicators in the SAVE component. So here we look at having sufficient liquid savings by the number of months of living expenses. And this is important because liquid savings, and really by this indicator we meant kind of emergency savings, is important for coping with unexpected expenses and also a potential sudden drop in income. Here the benchmarks that we presented have to do with how many months of living expenses you have, 6 or more, 1 to 5, or less than 1. And then in terms of proxies here would really just try and get at someone's overall savings behavior. So it may not be possible to know the exact amount of savings that people have in liquid accounts for emergencies, but savings behaviors can be observed in a number of ways. So for instance, do people have automatic deposits or electronic transfers set up where you know that they're putting money away for future use automatically? Some consumers also have this kind of save up and then spend down behavior, where they'll build up a savings cushion and then it will be used for some unexpected shock or planned expense, which is also very effective. In terms of measurement challenges, it's obviously difficult to account for all household accounts and expenses, and also often some savings may be held in informal locations, and we don't want to underestimate the support that people receive from social networks when they face some type of shock or emergency. And then also defining what living expenses are will obviously vary based on household composition and other circumstances of your life. So Michael, talk to us about your thoughts on this specific indicator.
Yeah, great, thanks. I really am excited about this indicator. I think there's a significant and growing amount of research that suggests that not all savings is equal, and if there's one kind of savings that consumers and households have that has some special quality, it's the emergency savings. It's the contingency fund. It's having something liquid to dip into when there's a spike in expenses or a dip in income. It's what helps people to avoid hardships. It's what helps people to be able to take advantage of opportunities when they come along. So, if I were to make a guess of the 8 measures, this one would be one that's going to end up being, quite powerful. And, it kind of makes sense if you think about the kind of volatility that people face in their day-to-day lives in terms of managing their finances, having that cushion. And certainly there are other forms of cushion that people use, including, liquidity that they get through credit. But the ability to have cash, especially for paying for things that can only be paid in cash, and just the ability to tap finances quickly, which savings provides, can be a really important component. So I think this is a really important measure. I think the the nuance of how this is being couched as being number of months of living expenses. Sometimes you'll see this kinds of measure as based on income instead of living expenses. But what people really worry about is not income for its own sake, but income for what it allows them to do, like pay rent and pay for food. And so this gets more to the heart of, I know it's harder to measure the living expenses side, but it really gets more at the heart of what causes that stress and what causes those hardships for people when they can't afford those daily living expenses they need to make. So I'm really encouraged by this measure, and I'm hopeful that it'll pan out as you start to do your beta testing later.
And there's been a few questions that have come in that I think relate to this indicator in particular about how kind of cash flow volatility that we see in a lot of families, and also irregular or lumpy income kind of influences the way we think about some of these more static measurements, especially around do you have 6 months of living expenses or even income, like you're saying, when income may be kind of up and down and not always the same amount every month. Can you speak a little bit to just how we should take into account income and expense volatility when we're thinking about some of these measurements?
Yeah, I think it's a really important issue, and the timing of how these kinds of measures, whether it's income or expenses, are come through. If you're paid once a month, as the end of the month approaches, then your liquid savings is probably getting quite depleted. At the beginning of the month, it might be quite high, and so we get a lot of variation in these measures, these account balances, and same if you have a way to measure people's consumption or their spend on a card or an account. It has these sort of very distinctive patterns based on when expenses come in and when income comes in. And I think it's a caution as we think about these kinds of measures that, just picking randomly, well, we'll pick the 15th or we'll pick the 10th or whatever. We have to be careful because that's going to result in different kinds of, maybe not different outcomes, but it's going to look like different outcomes for different populations. And as a result, we have to look at more comprehensive measures, perhaps looking at average daily balance, looking at, other kinds of measures to try to capture some of that variation and not end up with results that are biased for a choice that somebody made about what day of the month we should try to measure these things.
Yeah, and specifically around that kind of save up and spend, you may see an account where the savings balance is low, but that's just because that person just pulled down on their savings because of an emergency. And in some ways that's a good thing. They didn't have to go to high cost credit or, they actually had the savings there, but the moment in time when kind of the balance was checked, it may show that, oh no, this person has no savings. So it's a good point in terms of how often and when these things are monitored. Great, so let's move to the last indicator we're going to discuss in planning. So this one is around insurance. So this indicator was particularly difficult for our team to settle on. You'll notice that it's actually the only product-specific indicator on our list. All of the other indicators attempt to be product agnostic. And as you'll see here in the benchmarks, it's also very difficult to make general statements of what the correct insurance coverage should be, since it varies so much based on one's life circumstances. But insurance just seemed too important to leave off because it is so important in terms of being resilient in the face of unexpected expenses or death of a loved one, other types of emergencies. And we tried to just talk about, whether main assets and potential shocks were covered and the extent of that. In terms of measurement challenges, some of the challenges are around the fact that, the quality of insurance out there, both in terms and in price, varies greatly. So even those that have insurance may still face high deductibles that result in high bills. And we're seeing that a lot even now as everyone is mandated to have health insurance. It doesn't necessarily mean that they still won't have high kind of medical bills that will be a shock to their financial system. Having poor quality insurance policies may also give people a false sense of protection and planning. And then it's obviously difficult for financial institutions to know how many assets a customer has and what the appropriate level of coverage would be. There aren't great proxies here for financial data for this indicator, although there may be some creative ways that financial institutions can get access to the type of coverage that, that customers have. So Rick, I want to turn to you here and get your thoughts on this indicator and just the planning component overall.
Thanks. We understand the complexity that you've identified in looking at insurance in the context of financial health and ways to measure it. I do think, and it's been a source of discussion at the foundation and among colleagues at MetLife, I do think the presence or absence of insurance is an indicator, particularly if it's elected. Insurance in a benefits package concept is evidence of planning behavior, planning thinking. So I'm pleased that you've included insurance and focused on it. I think in the overall financial health and services discussions, insurance is often not central in discussion. So the planning certainly gives a chance to do that. I will mention that particularly for life insurance and thinking more of lower income consumers, a life insurance policy, if it's well defined for the individual, can also be an asset building product. It can accrue a cash value, and it can also be have a loan provision that's kind of a accessible credit option. So insurance also touches, in that regard, touches other areas of financial health. I want to mention two other things I think that attracted the foundation particularly to the planning indicator. One was the early segmentation research that CFSI produced, and looking at a spectrum of kind of risk to financial health. Planning was a clear differentiator, and people at the higher end of the spectrum tended to give more indication that they were planning. So we see that as a leverage point in our grant making to look at how planning is encouraged, enabled, incentivized, addressed in a variety of settings around financial health. The other thing I just wanted to mention is that planning is a placeholder for aspiration as part of the financial inclusion and financial health. And whether somebody's looking to improve their credit score or buy a car, planning for college for their children, seeking to buy a home, those are motivators. And I was sensitive to Brett's perspective on budgeting. I think people can plan without budgeting, and the goal is an important factor in that.
Yeah, I don't disagree with that, actually.
Yep, great. Good. So let's, before we open it up to more questions, and we have a lot of questions coming in, so thank you for that, and continue to add your questions in the chat box. Before we turn to questions, let's get into some of the specific challenges and opportunities that this type of measurement exercise presents. I will ask our speakers to be brief on this part, just so that we some questions, time for all the questions that are coming in. So this first one is around benchmarks. So as we said a little bit earlier, you know, in terms of how we approach the benchmarks, there's fluid movement along the spectrum of financial health. Just like physical health, you never kind of arrive at physical health, oh, I'm physically healthy. You never really arrive at financial health. It's much more of a continuum and a journey. And so that's why we use these three different colors to illustrate the direction of our benchmarks. Green kind of shows movement towards greater financial health. Yellow is kind of neither moving towards nor away, and then red would be behaviors that detract someone from the direction of greater financial health. So Brett, we thought a lot about the benchmark component and how aspirational or realistic the benchmark should be. And at Move-In, you've also thought a lot about this. From a user experience side, what have you learned about how to communicate with people regarding their financial health in a way that's encouraging, but also, realistic and kind of pushes them towards positive behaviors?
So again, it really comes down to frequency of how often you can get in front of someone. So for us, that simple element of using the receipt from a transaction and pushing that to someone and sort of showing where you sit in respect to that became very, very important, because it's that sort of, it's a gentle reminder, but if you're getting that 3 or 4 times a day, then that's probably about the best thing that you could get, which is just like, today you're financially healthy, tomorrow, well, what happened there? And we have a specific tool in the app, which I think contributes towards this significantly, which is what we call spending insights. So if you do have a bad day, then rather than just say, oh, that's bad, you need to learn from that experience. So we have these spending spikes or spending alerts that come through, and that'll either appear on your receipt or you get that as a separate notification. And it would say something like, you've spent 2.6 times your typical daily average spending today. So when you look back over the month at why you were not financially healthy or what had the most impact, you have these moments which you can clearly identify as, that was the moment that I lost control this month. And that's a learning process for our users.
And then here you have actually some screenshots of some of your app, and talk to us a little bit about some of the color schemes you've got going on here.
So here's a great illustration of the red and the green illustrator. So you've got here, if you look at the second screen grab here, you can see this is where you're in the green. You can see your typical spending, averaged over a few months. And then the green shows your current level of spending in that month. And then if you take a category view, which you get in real time as a customer, then if a specific category you're over, it turns red, and a specific category you're under, it's green. For the home screen, where you see spent so far this month, you can see the amount I spent and how much I typically spend, so how far ahead of that I am. And that's why in this particular illustration your app is in the red, because you spend more than you typically do. It's interesting though, even when we tested this, you can see this color is a little orange. It was very interesting from a psychology perspective that when this was fully red, this screen, people were really disturbed by it. They were like, oh, that's really bad, So by just softening the color use on that, I think it was more impactful. But I spoke about the spending insights and the spending alert. You see on the shopping category, which is a little handbag, you can see $296 and a little red indicator on that category. So here we've given a spending alert or a spending insight specifically against that category that demonstrates that you've gone over. Now remember, this is not about getting this and analyzing this at the end of the month and saying, right, next month I'm going to have to do better. The real trick with this is that it is in real time, and that's where you get the behavioral change. The problem with looking at this sort of data at the end of the month and being able to see this on a bank statement, for example, is that you still need the discipline, to make it effective. Where we found it most effective is when you walk out of the Walgreens or the Starbucks or whatever, or you're in the Uber, taxi, and you get that receipt on your phone and you get that specific category alert or the spending insight. Then you're associating this behavior I'm doing right now or the spending decision I just made, and now you understand the impact of that specific moment on your overall financial health. So that's where we really tried to focus on. I do believe there are, elements in terms of planning and retirement and investment strategy you can still do from a planning perspective, but for the people that really CFSI is targeting and the people you mentioned in your study, It needs to be a lot more tactical than that. It needs to be something every day I can do that will help me to get financially healthier.
Great. And there's one more screenshot there. But let's move to talking about attitudes and perceptions. So here our indicators are specifically focused on objective behaviors and outcomes, and that was deliberate. But similarly important are subjective attitudes. So levels of stress and confidence and satisfaction, these are all very important inputs because money is very emotional. So the CFPB recently put out a financial well-being scale, which is a set of 10 questions that gauges one's attitudes and perceptions towards their financial well-being. And Michael, you were involved in developing the CFPB's financial well-being scale. So I'm interested in some of your impressions just on objective measures versus these subjective attitudes and perceptions. What are your impressions of both and kind of some of the measurement challenges of each?
Yeah, great, and I appreciate you sharing the CFPB scale, and people should feel free to look at that and use that as they need, or include it in their own programming. I think the key thing about a scale like the subjective financial well-being scale is that it's asking people about how they feel, asking people about what they're doing, and so it's getting a better sense of how things feel and what kinds of activities they're engaged in. And it's possible and quite likely that oftentimes the objective kinds of measures of account balances and other behaviors are highly correlated with people's well-being. It's also possible that people are at a life stage or they're at a point in their particular career or whatever else it is that is going on in their life where those things diverge. And so people might have relatively high debt and low savings and yet feel pretty good because, say, they're starting a new business, or there's something else going on that isn't readily apparent in the objective metrics that we might have from accounts. So in the end, I think these two things are complements. It helps us get a sense of how one may lead or lag the other. In general, I think we're probably going to see a convergence of some objective measures which are predictive of the financial attitudes and perceptions and sort of a positive correlation there. But there are going to be times, and it's going to be good for us as this research develops, to try to figure out those moments when they actually do diverge. When are the points in time when people feel more stress even though they might have more savings or they might have less debt? And I think these are going to be important areas for the field, and it's also going to be an important part of what we can embed into service delivery and embed into product development in the future.
Yeah, and there was a question of someone asking about, is there data out there that kind of shows any link between, let's say, how much time people spend thinking about their finances and, their financial health, meaning if they're stressed about their finances, that can impact lots of things, their overall quality of life, their productivity at work, lots of things like that. And I know you mentioned that it would be really interesting to see that correlation. Is any of that data already out there?
This is still a relatively new field. Unlike many fields, we're still developing our measures. So we have some, measures that are sort of incomplete or in development, and other measures that are more developed. But I think the early evidence does suggest that there is definitely a trend where when people are having stress in their financial life, it bleeds over to other parts of their life, their health, their parenting behavior, other parts of their world. So it's something that we're going to continue to research, and this connections between financial status, financial behavior, financial perception. But clearly, this is a part of what makes us who we are and allows us to do the things that we want to do. And as we better understand how these trends work with each other, maybe we'll come up with better interventions and think about new products that might help people manage these sort of ups and downs as they occur.
Yeah, great. And then finally, I just wanted to, and this actually segues into employee well-being, talking about kind of stress and happiness. Employers are really starting to be more proactive about the well-being of their employees, and this can really be seen as an employee benefit, as a strategy for higher retention, productivity. And Rick, I wanted you to speak to this one because MetLife has a lot of initiatives around this, specifically from the employee benefit angle. So what have you seen from your own benefits team, and how might this relate to some of the measurement of financial health that we've been discussing?
Thanks. I did mention earlier that MetLife conducts an annual employee benefits trends study. And as I've looked at that personally, I've been impressed because it looks, Michael mentioned kind of looking at financial health across the lifespan. And this report particularly looks at how employees as consumers think about their financial lives, opportunities, vulnerabilities, including differences across 3 generations. Those are also differences across life stages. Because it's a trend study, I think it's in its 14th year, there's an opportunity for it to contribute insight to the field about changing attitudes and behaviors particularly around employees as consumers. I personally think there's a strong resonance between the research MetLife's doing and the CFSI research, ways for them to be complementary. And my hope is that the MetLife research might actually be helpful in building the case, a business case, that financial health should be a focus, a stronger focus for service and product providers going forward.
Great, fantastic. So I've tried to keep up with your questions as they've been coming in and pose them to our speakers as you've been going along. There are a couple that I would like to ask now before we kind of move to the end of this webinar in a few minutes. So one, Michael, I might pose to you. There was a question around how services are somewhat shifting from institution-driven to more person-to-person driven, and in particular, the person was wondering, is the credit score still an important indicator of financial health, even though we know it shouldn't just be the credit score anymore, in a world where there's lots of alternative ways of underwriting and trust models and that kind of thing. What role does the credit score have going forward, do you think?
I think on average, credit scores have proven to be very powerful tools for predicting, both contemporaneous behavior as well as future behavior. And, in fact, credit scores have been applied in more than just credit. They've been used to look at behavior in driving or in other kinds of risk-taking that people engage in, including even health. So it's certainly by no means are we saying that everything we're discussing here today should supplant the credit score. The credit score should be banned. But I think there are times when the credit score is at best a noisy measure. Maybe it's a lagging measure, and we oftentimes need measures that are again sort of meeting people where they're at and perhaps more predictive for certain subgroups or for groups that are at certain points in the life cycle where they're the credit score really isn't as useful as a measure, isn't reliable as a measure as that maybe some other measures are. I think, again, I'll go back to the analogy I began with in the beginning, is when we go to the doctor's office, we get weighed, we get blood pressure, we get temperature, we get lots of things. And, it took a long time for all those measures to develop. And different measures and different combinations of measures mean different things for different people. And the physician's there to help interpret that. But ultimately, it's, also questions of how are you feeling? And, what kind of symptoms are you feeling? And so it's, as we evolve this field, we're going to, have a greater set of tools. And, it's really up to us as practitioners and researchers and regulators to try to figure out how to best use the set of tools that we have today.
Yeah, great. And while the physical health measurements field is very well developed, we're really just getting started in the financial world. So yeah, we do have a lot of work to do. I think we probably won't take any more questions just because we're running out of time, but thank you for all of the questions that have come in, and I tried to get to as many as we could. Just before we finish up, I did want to, there have been several questions about this PowerPoint deck and other resources, so let me go through that very quickly. Today we released an executive summary deck, which is has more information than the things that were on this webinar. So you can go to this bit.ly and you can download the deck today, and it has a lot of detail about the things we've been discussing. And then in the next month or so, we'll be releasing a full report with even more details. And so sign up for our research alerts, and we'll let you know when that comes out in mid-May. Specifically in that full report, we provide all of the things listed here about each indicator. So we went through some of them today, benchmarks and why this indicator is important, but we also provide data to collect and where data sources may come from, and financial data proxies, survey question alternatives. We talk about customer variability and ways providers can help. So that report will be coming out in a few weeks. And also we'll have 3 case studies featuring 3 companies that are measuring financial health in creative ways: Hello Wallet, Solutions for Progress through their My Budget Coach platform, and then also Wells Fargo. So that will also be coming out in the next few weeks. What's next in terms of what we're doing is we're beta testing this. So now that we have the indicators, CFSI is working with a group of financial institutions to test these indicators and to also test a beta version of a financial health score that we've begun to develop. And we'll be releasing learnings from this project along with a revised financial health score in 2017. This project is also supported by MetLife Foundation. And then finally, in closing, here are a couple of our upcoming webinars, one on secured credit cards in May, and then one on financial health at work, kind of speaking to what Rick was just mentioning, in June. And then finally, you won't want to miss our annual Emerge conference in June, which is in New Orleans. And with that, I'd like to thank our speakers. I'd like to thank all of you for joining. Please do download the full deck and be on the lookout for more resources coming out over the next few weeks. I will go back to that bit.ly. Some of you asked for that, so it's right there, bit.ly.com/FinHealthDeck. And we look forward to hearing your comments on the indicators. Thanks so much. Have a great rest of your day.